Welcome to this video. Bit of a global update first of all from the World Health Organization. Some bulletins from the United States, some updates from the Centre for Disease Control, which is interesting, and a bit about the UK and the complete debacle in the numbers that the Public Health England got completely wrong, or very largely wrong, for a fairly long period of time actually. So that's what we're on with today. Quite interesting things really. World Health Organization are saying that 10% of the world's population have now probably been exposed to SARS coronavirus 2. 10% of the world's population so far. And of course you don't have to be a mathematician to work out that means 90% have not been exposed. What this means is the World Health Organization is sending a message loud and clear here, saying we are just near the start of this pandemic. A lot of people are still vulnerable to SARS coronavirus 2 causing COVID-19 disease. That seems to be the main message that they're giving. So this is Mike Ryan, former orthopedic surgeon, proper medical man, proper doctor. Best estimates, he's talking about 10%. That works out at 760 million people have had the infection so far. And there's probably about 5.32 billion people actually susceptible. And basing that on the 70%, because at 70%, when 70% of people are infected, there'll be herd immunity and the cases should dramatically die down. So you can see from that there's still 4.5 billion people or so left to become infected potentially. So we're still near the start of this, is what he's saying. Now, Johns Hopkins figure of 35 million people have been infected compared to the real number, which is probably 760 million, means that Johns Hopkins is picking up 4.6%. Not Johns Hopkins, of course, they're reflecting the official number of people tested. So less than 1 in 20 people that are being infected are being formally diagnosed, and that's not surprising. We have actually thought that for some time, but it's good to get it confirmed from the World Health Organization. Deaths from Johns Hopkins are just over 1 million, of course. Now, if we assume that 760 million people have been infected, which is probably in the right area, 10% of the world's population, and if we also assume that the death rate is just over 1 million, two pretty big assumptions, of course. I suspect the death rate is actually much higher than that. But let's stick with that for now. That will give us an infection fatality rate of 0.13%. Now, from UK data, we think the infection fatality rate is probably about 0.3%, maybe slightly more. So, given that the UK has got a relatively older population compared to the rest of the world, these figures are not incompatible by any means. So, is the infection fatality rate 0.13%? Well, given that that number is approximately correct, and this is based on evidence, Dr. Ryan's not just saying this, he's got various serological studies and things I would hope he's putting together to give that. So given that 760 million people affected, and the deaths are that would give the infection fatality rate as 0.13. But suppose the deaths are more than that, even suppose the deaths are double that. So let's suppose that the actual deaths are 2 million, or over 2 million. That would actually give us an infection fatality rate of double that, which would be 0.26%, which is getting very, very similar to the 0.3% figure that's postulated was probably the most accurate figure we've got for the UK. So I think we can say now the infection fatality rate for SARS coronavirus 2 is probably somewhere between 0.13 and 0.26 on a global basis. Now that still transposes into several millions of deaths potentially around the world. Hope it doesn't really come to that. I think it works out about 6.5–7 million potential deaths. But that's kind of the infection fatality rates we're looking at. So not insignificant by any means, but nothing like as bad as I feared at the start of this pandemic. At the start of this pandemic, we were getting infection fatality rates from China of 4, 5, 6, 7%, and that was pretty frightening. So at the time on this channel, we did predict the pandemic. We were right about that, but I'm delighted to say I overestimated the deaths originally. And it's looking like this is the infection fatality rate now is in this area, 0.13 to 0.3, 0.26% infection fatality rate. So while the world has still got a significant problem, I must say I am experiencing a sense of relief as I'm discussing this with you, because I had feared it would be worse, and I'm delighted that those fears don't appear to be as bad as I feared they would be. So we're still in a bad situation, but personally, all I can tell you is I am actually feeling a bit of a sense of relief now, because I thought it was probably going to be worse. So this is looking, I can't say it's looking good, it's the way it is, but that's where we're at. Dr. Ryan says we're now heading for a difficult period, obviously. The disease continues to spread, as we know. Asia faces a surge in cases. India, Pakistan, Bangladesh we're concerned about. Europe and the Eastern Mediterranean increasing deaths, and Africa and Western Pacific were rather more positive. So that was his global quick review. And we've looked at all these ourselves, of course, the low infection fatality rate in Africa, which remains encouraging. Now, where did this virus come from? Good question. So the World Health Organization, we've now learnt, is putting together a list of experts to go on an international mission to China to discover the origins of the coronavirus, and that list of individuals is now being considered by the Chinese authorities. So the Chinese authorities appear to be adjudicating the appropriateness of the individuals, of the experts proposed by the World Health Organization. So this virus originated in Wuhan in China, we're fairly sure about that. Other than that, I can't say we're sure about too much else. This virus spread around the world because of initial suppression of the information by the Chinese local authorities, not the Chinese national authorities, it has to be said. When Chinese national authorities found out there was significant action taken. But then the World Health Organization completely seemed to underestimate the severity of what was happening. We talked about it on this channel. We were using the pandemic word way back in February. Unfortunately, international flights continued for quite some time after that. And we've ended up where we are. Anyway, so interesting to see what they come up with. Let's hope, I'm hoping to live long enough to read their report, which I'm already looking forward to, although I may end up being disappointed by its contents. Let's hope I'm not. Right, United States. Let's look at some graphics from the United States. The figures keep going up, don't they? So we're looking at getting on for 7.5 million cases, getting on for 210,000 deaths. 300,000 cases in the last 7 days. It's not going anywhere, is it? Now, this graphic is rather nice because you can switch between all sorts of things. So you can have total cases per 100,000 deaths, all sorts of data there for your perusal. And of course, I always include the link. Now, good thing about the United States is hospitalizations still appear to be going down. So that is the data for the week 39, the week of the 26th of September, and it's carrying on going down in all age categories. So that is very encouraging. But we can also look at this. We can also look at the trends on this previous graphic. So we can see we're not falling off as dramatically as we like, but the deaths do seem to be going down gradually. So some encouragement there from that Centre for Disease Control data. So yeah. Now current cases, active cases in the United States, estimated to be 2.5 million estimated current active cases. That's according to World Meter. So it's still a significant problem. Now, you remember the, well, if it wasn't so serious, you would probably say amusing episode about a month ago, where the Centre for Disease Control put up some information saying that this virus could be spread via aerosolization on the Friday, took it down on the Monday, it was posted by mistake. Anyway, now they are definitive. So let's look at the definitive statements from the Centers for Disease Control in the United States about how this virus spreads. Now, they say it's mainly through close contact. That's the main thing. They confirm that asymptomatic people can spread, and pre-symptomatic for at least 48 hours prior to infection, we also now know. Now, they don't know if the spread of the virus is related to the severity of the disease. They openly say they don't know that. Now, this is based on the idea that if you wear a mask, you have reduced viral load, and that reduced viral load makes you more likely to have an asymptomatic or minimally symptomatic infection. There's quite a lot of evidence for that, but the Centre for Disease Control is saying they don't know that one yet. They haven't got enough data to be definitive. Which, okay, it's fair enough. They're not sure. Okay, I'll give them that. They're not sure. More effectively spread than influenza. This disease is more transmissible than seasonal flu, but not as efficiently spread as measles. I would hope not. Measles spreads like wildfire. So anyway, so what they're saying is the transmissibility is more than seasonal flu, less than measles. But they are now talking about respiratory droplets. Small droplets can form drier particles. Small droplets and particles can hang in the air for minutes to hours. Now, I'm glad they're actually saying this now, because we've been saying this. We've been looking at data that says the aerosols can stay in the air for perhaps about 3 hours. And we've looked at that for quite some time now, and now they seem to be confirming that. And this is of immense importance, of course, because it means that it can spread further than 6 feet because it's airborne transmission, as is tuberculosis, measles, chickenpox. Now, this is what surprises me here. We've known for decades that measles, tuberculosis, chickenpox are spread by aerosol infection. So why was there such staunch resistance to accepting the evidence, which has been accumulating for months now, that this virus is spread by aerosolization? I remember discussing this back in February from early Chinese data. But the World Health Organization was very reluctant to accept it, to put it mildly. The Centre for Disease Control was very reluctant to accept it, to put it mildly. While they were being reluctant to accept it, the disease has spread all around the world. You see, this is not new. This is known from other diseases. And why didn't these experts, or so-called experts in infectious diseases, realise this? It's a bit strange. It's a bit strange. Few people have been slow off the ball, let's say, slow off the mark. Right, therefore, the implications. Enclosed spaces with inadequate ventilation. I'm glad to see they put ventilation down there. Big risk. Singing or exercising or anything causing hyperventilation greatly increases the risk. So you could go into a poorly ventilated room 1 hour, 2 hours, 3 hours, 4 hours later, after someone had been, for example, singing in there who had SARS coronavirus 2, and the virus can be in the air at doses which are high enough for it to get into your mucous membranes and cause infection in you. This is now what the Centers for Disease Control are saying, as we've suspected for a long time. Glad they've got updated now. In the same space during or shortly after the person has left. So the person could have already left the room. That's important to know. Spread from touching surfaces, the fomite idea. Not a common way that COVID-19 spreads, so it's mostly in the air. Cats and dogs can get the disease, but spread from animals to humans is a very low risk. Right, now let us do a bit of an update on the president. I hope you got the chance to watch yesterday's video where we looked at the full therapeutics that President Trump has been receiving, and interesting. I thought that was an interesting video with a lot of application. So 1st of October, Thursday, diagnosed. tweeted 1 o'clock in the morning on Friday that he had it. So his day one, first day of being symptomatic, was the Friday. Friday evening he went to hospital, back home at the 5th to the White House. Therefore he needs to self-isolate according to WHO guidelines until the 11th of October. Now, this means that the president is currently only on day 5 or 6 of the infection. And everyone seems to be assuming, although the doctors have put in caveats, that this is it. He's been to hospital, treated, out, better, cured, job done. I'm afraid the disease doesn't work like that. I hope he does well. But in his age group, we've looked. There's between a 4 and 5% infection fatality rate in that in the age group. That risk is there. I think the treatment is received, especially the monoclonal antibody cocktail, would have greatly reduced that. I think that could be a very effective treatment. But we know that many people can have a first 7-8 days that aren't too bad. Then day 8, 9, 10, 11, 12, they can become quite ill. The president is not out of the woods yet. I hope it doesn't happen, but there is still a real possibility his condition could significantly worsen. This is not over yet. We won't be sure that he is completely better if he remains as minimally or asymptomatic as he is now for another week at least. Many people deteriorate in the second week. So we are still in unknown territory. Although, as I say, I think the risk will be reduced because he's had that antibody therapy. And I believe he's still taking zinc and vitamin D, which will also help. But we cannot talk with confidence for another week at least yet. Now, finally, the United Kingdom. That's the number of cases lost by Public Health England. Now, this is just unbelievable. They were using an out-of-date version of Excel. I think it took 65,000 cases. After that, they simply vanished. I mean, the level of ineptitude here is just unbelievable. I really hope managers at Public Health England will be held accountable for this debacle. I strongly suspect they won't. They'll get away with it as they usually do. But the lack of accountability here is just stunning. The level of incompetence is really quite incredible. This is basic data management failure. The people underneath, after the database was full, they were automatically thrown off the Excel spreadsheet as if they weren't there. Now, each positive case typically throws up 3 close contacts that, of course, need to be contacted and need to be isolated. So given that there was almost 16,000 cases lost, simply fallen off the radar by Public Health England, we had probably 48,000 contacts who were going around in blissful ignorance, just living their lives as normal, not realising they were potentially spreading the virus. And of course, each of those could infect 3 more. This has got real implications for the spread of the virus in the UK, because someone didn't realise Excel was not doing the job they wanted it to do. Now, new cases not tracked since the 24th of September. So this number of cases is the number of cases not tracked since the 24th of September. Now, what's happened now is the government have just put them all on over the weekend, basically. So we see they've just been added here. So these numbers aren't real. The total number is real, but they've just put the numbers that they missed on. So these numbers should have been registering here, but now they've just put them all on. So the numbers are now up to date, but don't represent the accurate rate of accumulation. Likewise, there cases by date reported, and cases by date reported by nation. Okay, right. So there we are. So after that farce, we are now up to date again. So isn't it good to be up to date again? Because we are. That's good. So that's the positive to take away. We're now up to date. And the up-to-date data shows that cases have tripled in the past 2 weeks. Unfortunately, that's what the data is showing. Steep rise in university cities, as we expected here. Manchester's gone up from 247 to 529 cases per 100,000 people in the past week alone. We did expect that sort of thing. Obviously, Liverpool, University upon Tyne, Newcastle upon Tyne, Nottingham, Leeds, Sheffield, or university areas. As we did anticipate, and students, of course, many students are still quarantining or isolating in situ. Now, after this debacle, there's a new organisation being started. Well, Public Health England has had a bit of a cloud over it for some time. So we're having a new organisation called National Institute for Health Protection. Let's hope they just don't take the same incompetent employees and put a new sign on the door, as tends to happen with these reorganisations. I'm sorry about being so cynical about this, but having been associated with the health service for over 40 years, I've seen this happen a few times now. Let's hope it's better this time. Let's hope it's better. So cases, new cases just past 24 hours, 12,500, giving rise to over 500,000. COVID symptom tracker app, the real number is probably nearer 21,000, and that's an underestimate because that only picks up the symptomatic cases, and that means that there's probably 272,000 people currently symptomatic. And let's just look at that from the COVID symptom tracker study, which we have here. Where are we? Yep, there we go, 272,000. That's the map of the country with distribution areas. Do spend some time on this, interesting. We see the darker areas here in Scotland and the north, Northern Ireland, representing greater new cases per million people. But the one I really wanted to show you is this, showing the number of people calculated to have COVID symptoms on each day since the 11th of June. Dramatic increase of late, unfortunately. Now, Office for National Statistics. Last full week of data now, 18th to 24th September. Complete data now. At that time, there was 116,000 people infected. Now it looks like there's way more people infected now. That was 1 in 500. Wales, it was 6,400, which was also 1 in 500 people infected. Northern Ireland, it was higher, 1 in 400 people infected. Deaths in England and Wales, that's the number of deaths for the week. 215, that's 2.2%, had COVID-19 or SARS coronavirus 2 on the death certificate, a slight increase. Okay, so that's what I wanted to do today. Before we finish, I've been very pleased to see the President of the United States wearing a mask in public. It would be nice if he'd worn it more consistently, but I'm delighted to see he was wearing it. So I thought this was a good opportunity to relook at some of our T-shirt slogans. Now, I've never actually got the T-shirts made up, so you'll have to use your imagination, but that's the first one. Masks are critical, not political. You know, it's absolutely crucial, people, that you wear a mask. You know, don't care where you are. Masks are critical, not political. But glad to see the President's wearing a mask now, setting a good example some of the time. But remember the trustworthy saying. That's the trustworthy saying. So I thought we might have a look at a couple more trustworthy sayings just to finish. We've been talking about that one for a long time, haven't we? People have reacted to this all the way through rather than anticipating. And we've been showing this one since February, I think. We're all in this together. Our health depends on everyone else. We have to follow the evidence wherever it leads. If you don't like the evidence, tough. That's what the evidence says. And of course, this applies to my mind, everything. all belief should be based on evidence, wherever it leads. Ideally, all decisions should be based on evidence. Then we're in contact with reality and not living in our own synthesized matrix. 2 meters distance determines our existence, you might remember that. And from way back in the early days, catch it, bin it, kill it, don't sneeze and cough around the place, because coughs and sneezes spread diseases. And we still need to bear in mind basic hand hygiene. Even though the Centre for Disease Control has said that's not a main modality of spread, it's still good to do that. So, just looking at that graph again, the increases in the UK. So what's going to happen over the next weeks? Well, Mike Ryan from the World Health Organization says we're in for a difficult time. And we've known for a while that this winter is going to be the challenge. Okay, so thank you for watching, as always.